you or a loved one is facing a serious or life-limiting illness, the best time to find out about your options is before facing a medical crisis. November is National Hospice and Palliative Care Month. This year's theme is Know Your Options. During this awareness month, the team at Cornerstone Hospice wants you to know there is high-quality, compassionate comfort and support for patients and their families facing serious illness.
We want folks to understand that when we talk about palliative care, we're really talking about symptom control and comfort measures rather than aggressive illness treatment. So someone who may be earlier in life than that sort of traditional last 6 months that we have for hospice care, but who needs comfort care and support, but doesn't necessarily want to pursue a lot of aggressive measures, our team can go and provide a similar kind of support earlier in the disease process. Probably the biggest myth that people have about hospice care is that it's a place that you have to go. And certainly we have our own hospice houses that provide a wonderful environment for patients and families who can't manage where they've been calling home. But for most of our patients, about 95% of them, our team goes in to provide care in that location that they call home, whether it's their actual house, an assisted living facility, or skilled nursing facility. That's important because most folks want to spend their final days surrounded by friends and family in that environment that's most comfortable to them. And what we find is that when we can do that, they have more peace of mind, they have less stress, it's a calmer environment, and the families are more comfortable with it. This is a place that they've been familiar with for a long time. And if we do it in partnership with an assisted living or skilled nursing, the patients and families have gotten to know that facility staff, and they're getting to know our staff. It just makes for a much more positive environment when it's a familiar. We come in and we assess what's going on with the patient and the family, and we design an individualized plan of care, and then update that plan of care as time goes by. We update it every couple of weeks. And then as a result of the conversation that we're having with the patient and their loved ones, we bring a full complement of professionals and resources to bear so that we can meet the full scope of needs that they may be facing.
As part of their commitment to helping Lake County families know their options, Cornerstone Hospice recently teamed up with Florida Hospital Waterman and Florida Cancer Specialists to sponsor the Gynecological Cancer Leadership Forum at Osprey Lodge. The event focused on sharing information with physicians and the community about the resources available for patients facing a gynecological cancer diagnosis.
I think that it's important that we connect with many of the community physicians here because there's a lot of sometimes fears and concerns and unknown areas that involve hospice, palliation, any types of things that involve cancer and even gynecologic cancer. So by coming out here, having us sponsor it, talk to the community physicians, both about kind of the mixing of both symptom management and oncology care, as well as palliative, hospice, and end-of-life care when it can become appropriate and some of the signs of it, hopefully will help everybody feel more comfortable about it and a little bit more open at talking about it with just their patients amongst themselves and in the community at large.
For more information on Cornerstone Hospice and the palliative care they provide, please follow the Know Your Options story link on our homepage, yourhometownhealth.com.